Welcome to today's update. Looking at a few countries this morning, and I think there might be a lesson we can learn from history as well today, so stick around. Now, starting off with the global cases today, these are the official figures. Nearly 250,000 extra cases in 24 hours on the official figures. And of course, as more and more testing programs come online around the world, this is getting closer to the actual figure, but this of course is still going to be a huge underestimate of the total amount of infections. And in 24 hours, well over 3,500 deaths recorded globally. Now I want to start off with Australia today. And we know there's been this outbreak in Victoria. Now things are getting better. There was an extra 35 cases in Victoria, giving rise to 19,827 cases in the state of Victoria, down there in the bottom right hand corner of Australia. And 75% of the country's active cases are currently in Victoria. Now, police enforcement has unfortunately been necessary, and there's been 74 people arrested and 176 fined as the police crack down on people breaking the quarantine. Now, I can understand this. Melbourne's been locked down for 6 weeks now. It hasn't been easy. Melbourne has had a difficult time, and Melbourne really is the kind of sentinel for Australia. Containing the cases in Melbourne means that the cases aren't getting to the rest of Australia. But sadly, that has meant that in Victoria as a whole, there's been 729 deaths. So I'm seeing Victoria and Melbourne particularly as the sentinel. Melbourne's taken it on the chin for the rest of Australia, but it is working. There's been cases, as we'll see, in New South Wales and Victoria, but no other states in Australia. So it is working. Now, I just wanted to tell you a bit of a story. It's not a story, it's a historical account. And I'll post this in the notes. It's about the Derbyshire village of Eyam. And this goes back to 1665. Now, what happened, there was a flea-infested bundle of cloth went from London to this Derbyshire village in Eyam in 1665, the year of the Great Plague in London. And pretty soon the bubonic plague broke out in the village of Eyam. And there's multiple references. I haven't put a reference on the notes because there's so many references for this, but the villagers got together with the local church people, and they decided that they were going to stay in the village and not spread the infection to the surrounding areas and on into the north of England. And it was decided that there would be what we would now call bubbles. The families lived in household bubbles, and that went to the extent that the families were expected to bury their own dead. Outdoor church services were held with family bubbles. We haven't invented this. It was invented way back in 1665. So the church services went outdoors with separated families. The entire village was quarantined. Trade was via marked rocks around the circumference of the village. Money would be left in pits filled with vinegar to clean the money, and goods would be left. And of course the village spent pretty well all of its money during the isolation period. It was over 14 months it took for the plague to run its course. The population at the start was between 350 and 800. The parish record showed that 273 people died of the plague. So I'm going to put those notes in there for you to read through. About the village of Eyam. This is very famous in English culture. This village and what they did. And what is amazing about this story? It's not a story; it's an account. What is amazing about this account is that no one left the village in 14 months. So parents would see one child die, and instead of sending the other child away, they stayed in the village. A man would see his brother or sister die, knowing he or she could well die, and they stayed in the village. Everyone stayed in the village. And Elizabeth Hancock buried 6 of her children and her husband in an 8-day period, and yet still stayed in the village. And by doing so, they prevented the plague going for the rest of the country. This is the level of nobility that human beings are capable of. and at least they were. I believe they still are, of course. This was in the year 1665, the year of the Great Plague of London. So very famous. You can still go to the village of Eyam. The parish records are there. The plaques are on the houses to say where people died, and a remarkably moving experience if you ever get that chance to do that. And I've managed to go through all of that without the emotion I expressed during the preparation of that. Just what those people did, absolutely amazing. And in a similar way, Melbourne is the sentinel for Australia. So just to encourage the people in Melbourne at the moment, really, that's kind of what that was about. But anywhere where sacrifices are being made, but we have these great examples of nobility to look towards. Now, New South Wales, 4 new cases. So very much less affected than Victoria. Deaths 52 now in New South Wales. But in all of the other states in Australia, no new cases. So it's working. This sentinel policy is working. The virus is not spreading around Australia. It is working. And then if we look at the graph for Australia, we see this. Let me get rid of me a minute. There we go. Yep. So this was the first outbreak that we knew of back in March, April. This was the second outbreak, much bigger, mostly in Victoria, some in New South Wales. But we do see that it's working. Now, of course, the cumulative number of cases can only rise. That's always going to rise, of course. And let's hope that becomes flat now. This is what we're hoping for, as these cases go dramatically down as a result of the effects that we're seeing in Melbourne. So it is working. It is working. And maybe it's helpful to remember the example of Eyam in Derbyshire and the self-sacrifice of the people. I mean, how many lives did those people in Eyam save? You know, was it 1 million? We'll never know, of course, but it could have been a lot of people. Now, Israel. We did notice Israel yesterday. Benjamin Netanyahu, stay-at-home order, has issued a stay-at-home order. Countrywide lockdown from Friday, so it's not yet, another few days. Start of the Jewish high holiday, so he wouldn't do it lightly. Schools, restaurants and hotels will shut down. Restrictions on movement. So we did see the dramatic increase in cases in Israel on the graphs yesterday. Not quite sure what's happened. The news is actually quite hard to get. I haven't had much detailed news from Israel, but anyway, the virus has basically got out of control there, and those measures are being deemed necessary by the government. So quite drastic measures really in Israel. Now, just a couple of European countries we don't normally mention. Austria, population 9 million. This just illustrates the increasing cases in Europe, really. The cases are increasing pretty well everywhere in Europe, more steeply in some places than others. So over the weekend, 869 new cases, largely in Vienna, the capital. The Chancellor has said they are experiencing a second wave, Sebastian Kurz. He expects the cases to go up to 1,000 a day within a few days. Mandatory mask wearing in public places. Now this is good, because what I'm hoping with this mandatory mask wearing in public places is that the people that do become infected are going to get less severe disease. That's what the current evidence is pointing towards, so that is encouraging. And I do hope you managed to watch that very encouraging video yesterday about the decreasing death rates. We believe in all age groups. The data from Germany suggests it's in all age groups. We haven't got data from everywhere because not everywhere collects data as comprehensively as Germany does, but it's looking encouraging. The infection fatality rates have been dropping significantly. And let's hope that carries on as a result of the mask wearing in Austria. Czech Republic also got on new cases, and the health minister said nobody expected such a spike. So they seem to have been taken a bit by surprise there in the Czech Republic, which is a bit surprising really, but never mind. Now, the UK tracker app today shows 4,222 new cases and 44,947 people with the infection today in the UK. That's according to the COVID symptom tracker app. If anything, this underestimates, because these are people that are symptomatic. It doesn't count the asymptomatic cases. Now, the Office for National Statistics data is out today, out this morning. Always a bit behind, of course. So this is the 30th of August to the 5th of September 2020. In that week, 39,700 people had the infection during the week. So we compare that to what it is today, and we see it's gone up. This number is higher, but of course this number is actually higher. So what is it? Is it 52,000? We don't really know, because of the people that are asymptomatic. So we see the number has gone up in the UK, no question about that, from the week of the 30th of August to the 5th of September. Now that equates to about 1 in 1,400 people who had the infection in that week. Now in recent weeks, this is interesting, in recent weeks, 17 to 24-year-olds and 25 to 34-year-olds are the main increasing demographic. People aged over 50 appear to be stabilising or declining in numbers. So we see that the spread is very much among the younger demographic. That is the infection driver in the UK at the moment. The younger age group where the virus is spreading. And this is consistent with what we've seen basically all over Europe for some time now, that most spread is in the younger demographic. 28th of August, week 35 in England and Wales. Deaths always a bit of a delay, of course, because of the filling out the death certificates and the registration process. So in the week there was 9,032 deaths. That's above the 5-year average. But, you know, for quite a few weeks before this, we were below the 5-year average. So in a way, that's not too surprising, really, not too unexpected. Now, in that week, the 28th of August, weekend in the 28th of August, week 35, 101 deaths mentioned novel coronavirus as a contributing cause to the death. That's 1.1% of all deaths in England, and this is the lowest number involving COVID-19 in the past 24 weeks. So this is consistent with the infection fatality rate dropping off quite significantly as it has. The lowest number of deaths involving COVID-19 in the past 24 weeks. Now, we don't know what it is the week after that or this week, but that's what it was the week ending the 28th of August. And that represents a 27% decrease compared with week 34 the week before. So COVID deaths we see dropping down really quite nicely. Not as fast as we would like, of course, these are still deaths, but they are decreasing up till that date. The UK as a whole, deaths were 10,337 for the week for the UK as a whole. That's England, Scotland, Northern Ireland, Wales. A bit higher than the 5-year average, and 110 deaths involved COVID-19. 39 fewer deaths than the week before. So again, we see COVID-19 specific deaths up to this period of time, up to the end of August, continuing to drop. So that's good. Let's just hope that keeps up. Now, the United States has had a bit of an outbreak of virus and parties. I watched a video of a party being broken up in New York. Quite a few parties appear to be college related, giving rise to new clusters in colleges. And as of, this is old data, this is about 2 days old now. Yesterday, this was yesterday's figure. 88,000 cases on campus so far. So 88,000 students have tested positive on campuses, college campuses around the United States. A significant amount. And this has given rise to 150 colleges with 100 or more cases each. So there's 150 colleges around the United States now with clusters. There's been indoor political rallies, which just bemuses me entirely. Not a good idea. And the fires and storms in the United States are really quite appalling. Now, I think I can play you a video of some of this.
It's pretty weird. You can't even see the pier with Brian, which normally can see. And yesterday I was out here at the same time, and there were tons of birds, pelicans, seagulls, whatever. There are no birds. And what this is fog compressed down by smoke. And it's 4 o'clock in the afternoon.
Yeah, so there we go. I hope you got that okay. Now, that was from Evelyn, and that was taken at Cayucos, which I probably pronounced wrong, but I did notice on the map it's halfway between San Francisco and Los Angeles on the California coast. And we've looked at this before, but the smoke can cause inflammation in the lungs and make infection more likely. But the health risks from the smoke is just incredible. Not to mention the effects on the planet as a whole. This is really very concerning what's happening. And then Florida and Gulf of Mexico area, more storms expected. So quite a few things are coming together. So it's a difficult time for many people in the southern and western United States. I mean, the fires are in California, Oregon, Washington. And we saw yesterday Lindsay's report from British Columbia with the very extensive smoke. Now, yesterday I was talking about a video I'd watched with Dr. Fauci, and I actually messed up and didn't print a paper out, but it's interesting, so I thought I'd bring it to you today. Do listen to the whole interview. Herbs not recommended. If you want to use them, fine. And we had a debate about herbs versus herbs, but there you go. Other concoctions I would not use. Now, what Dr. Fauci has said here, and this is fairly well recognised, is that you can't boost the immune system beyond its optimum physiological level, but various deficiencies can bring it down below its physiological most efficient level. And Dr. Fauci himself takes vitamin C and vitamin D. It's a pity it's not in the official guidelines, but he's taking it himself. Now, I know it is in the official guidelines. Someone pulled me up on this yesterday, but the doses are remarkably low. The UK guidelines and the US guidelines advise a remarkably low dose. And it would be fascinating if Dr. Fauci's watching, which of course he isn't. But if he was, I'd just love to know what dose of vitamin D he's taking. That would be really interesting to know. We know we believe he's taking a high dose of vitamin C, much higher than I would take. But his vitamin D dose, we don't know. Wouldn't it be interesting to find out? If anyone knows him, ask him, what vitamin D dose are you taking, Dr. Anthony Fauci? Do tell us, so we can all benefit from your wisdom. Now, talked about flu shots as well. Dr. Fauci said everyone over 6 months or older should get a flu shot. So he's pretty definitive about that. And he said immunity may wear off with a flu shot. So he gets his in the middle of October, because most flu starts in November. And November, December, January, February for most flu. So he tends to get his later in the year. So I thought that was interesting, indicating that the immunity from the flu shot might only last for a few months. But this is encouraging. Australia's had its lightest flu season in memory. Fantastic. So very few cases of the flu in Australia. This is the normal influenza, of course, that we talk about. Where have I gone? There I am. Yeah, this is the normal influenza, the seasonal influenza, mostly influenza A. Now, of course, what seems to have happened here is it looks like, I mean, these flu viruses are there every year. Sometimes they're more transmissible, sometimes they cause more severe disease. They vary quite a lot. But with everyone taking the precautions against COVID-19 in Australia, those precautions are also working against seasonal influenza. So my hopes are that with high vaccine uptake on influenza, flu jabs this year, and with the social distancing and the mask wearing and the hand hygiene that we're going to have to keep practicing because of the COVID-19 anyway, I'm really hoping this is going to completely damp down the influenza season. Let's hope that is the case. It all makes sense, unless there's a particularly nasty influenza virus. But from the Australia situation, it looks not. And the Australia flu season, of course, comes first in the year because it's their winter now. So very often the flu viruses that affect Australia come to Europe and cause our infections in 3, 4, 5, 6 months after. So the fact that the Australians have got a light season to me is a good indicator that we may well have also, which of course would be brilliant. Now, just a couple of countries to finish. India, great increases in cases in India, and I'm getting reports from rural areas. It's hard to get good news out of India, but I'm getting reports that in rural areas, some people are not getting the quality of medical care that we would expect, and that's putting it mildly. So that is going to increase the case fatality rate unquestionably. In India, though, they are testing quite a lot, so that is good. But getting on for 5 million infections now. Now, Ethiopia, hard to get news out of Africa as well. We've had news out of South Africa where things are improving. But increasing cases in Ethiopia, up there in the top right-hand corner nearly of Africa. And they're starting to manufacture their own test kits. Now, I first read that and I thought that is absolutely brilliant. They're starting to manufacture their own test kits in Ethiopia. But of course, it's Chinese manufacturing. It's just a Chinese setup that's moved into Ethiopia. So unfortunately, it doesn't look like an Ethiopian initiative. It looks more like a Chinese initiative. Still good. They'll get the test kits done, but it's a pity the Ethiopians aren't doing it on their own. And they have opened a field hospital for 200 severe cases. Although, as I say, the news is very difficult to get out of Africa at the moment. The news we have had, and we've looked at this in detail on previous videos, is that it looks like the infection fatality rate in Africa is going to be, or so far, is very low. It was reasonably high in South Africa, but it looks like it's going to be lower in other African countries, partly due to the demographic and partly due to other factors that we don't yet fully understand. So that's us for today. Thank you for watching, and I hope you got something out of that video. Always good to have you along if you've stayed to the end.